Hello everyone, I'm Priyanka and today we will talk about renal calculi. First of all, let us discuss formation of stones. Kidney stones or renal calculi are small, hard deposits that form inside kidney. The stones are made up of minerals and acid salts. Hard, insoluble, crystallized minerals, salts that have formed out of the filtrate produced by nephron. So these are kidney stones. As we all know, nephron is the structure and function unit of kidney as it uh, filtered the blood where the most of the fluid part is reabsorbed and the waste and toxins are removed in the urine. Kidney stones can affect any part of urinary tract from kidney to bladder. The mineral salts come together, crystallize and form stones. Often, stones form when the urine becomes concentrated, allowing minerals to crystallize and stick together. Urinary stones may be composed of calcium oxalate, calcium phosphate, calcium carbonate, ammonium phosphate, carbonate, hepatite, uric acid and its salts, cysteine and xanthan. Pathogenesis of renal stones. There are two basic aspects in the pathogenesis of renal stones. First is increased urinary excretion of stone-forming elements like calcium, phosphorus, uric acid, oxalate and cysteine. Second, we have low fluid intake. A low fluid intake results in the production of concentrated urine, causing supersaturation and crystallization of stone-forming compounds. In addition, low urine flow rate favors crystal deposition on the urothelium. Physiochemical changes which influence the stone formations like pH of urine, stone matrix and protective substance in the urine. Removal of stones. The doctors follow different operational procedures for the removal of kidney stone based on location of the stones and the size of the stone. Most of the stones can be passed that is smaller than 5 millimeter are very painful but require removal techniques. Talking about the different symptoms, a patient may experience nausea, vomiting and pain depending upon the location of your stone. If the renal calvic stone is there, then the renal stone pelvic, the patient will experience dull, deep acts in flanks, um, in costal ventricle area. Uterine chronic, then stones move when stones move intense sharp wave like radiation pain to vaginal area. Uh, to determine the size and the location of the stones, uh, X-ray of stones like X-ray of kidney, uterus, bladder are taken, and then IVP, that is intravenous phlebotomy, where the IV dye like iodine based dye is given to the patient. Then X-ray is taken of the urinary system. So we have different options to determine the size and the location. Investigation of renal calculi. Urinary analysis and urine culture. It may show crystals, red blood cells, or pus cells in urine. Stone analysis. Chemical analysis of stone is a simple test but is not an accurate method, as we will discuss this today. For better option, we perform crystallography. Biochemical investigation. Serum, calcium, phosphorus, uric acid and renal function test. 24-hour urine test for calcium, phosphorus, uric acid, oxalate, citrate and cysteine. Investigation for special clinical situations like hypoparathyroidism quad should also be included. Let us discuss type of calculi. So we have 5 different type of kidney stones. First one, calcium stones. Calcium oxalate stones are formed in acidic urine due to increased amount of calcium and oxalate in urine. This happens when firstly the calcium amount is increased because of hypercalciuria, increased intake of sodium and uh, vitamin D toxicity and hypoparathyroidism. Oxalate increases as because of GI disorders. Normally, calcium and oxalate bind together in the gut. Oxalate is excreted in stool. In GI disorder, this calcium and the digestive pads bind and leaves oxalate like urine high oxalate because of some foods like spinach, strawberries, and large loss of vitamin C may increase the amount of the oxalate in urine. So, as we discussed, calcium stones are the most common type of kidney stones and occur in two major forms, that is calcium oxalate and calcium phosphate. Calcium oxalate, these are the most common ones. Calcium oxalate stones form may be because of high calcium and high oxalate excretion because of some food items like spinach, strawberry and large dose of vitamin C may increase the amount of the oxalate in your urine. Calcium phosphate stones. Calcium phosphate stones are caused by the combination of high urine calcium and alkaline urine. These are caused because of hypercalciuria caused by hyperparathyroidism and vitamin D toxicity. Uric acid stones form when the urine is constantly acidic. Excessive urinary uric acid. This may be caused because of diet rich in purines. A diet rich in purine contains seafoods, alcohol, and that's all about purine rich diet. Carbonate appetite that contains calcium carbonate and calcium phosphate stones. Struvate contains magnesium ammonium phosphate stone. These stones develop as a consequence of reoccurring or chronic urinary tract infections caused by urease producing bacteria. Some urinary bacteria can split the urea in urine to form ammonia and also to make urine less acidic. This may result in the formation of renal calculi. Next we have cysteine stones. develop in patients with cystinuria caused by mutation in the genes encoded for two parts of transport protein that is made primarily in the kidney. These defects prevent proper reabsorption of um, amino acids. These are the These are the figures show the micrographic taken by the scanning electron microscopy showing the calcium oxalate monohydrate leaf. Second figure indicates the micrograph taken by the scanning electron microscopy showing calcium oxalate dihydrate in pyramid. So now we will discuss the identification and qualitative analysis of kidney stones. These are the material required for the identification. For testing the type of the stones, we have following tests: test for the uric acid, test for the carbonate, test for the oxalate, test for the phosphate, and test for calcium. Test for uric acid stones. Uric acid undergo oxidation when treated with HNO3. Procedure: put a small amount of the sample 1, add 5 to 7 drops of concentrated nitric acid, then heating in the water bath. Yellow to orange color on the inner surface of the test tube indicate the presence of uric acid stones. Next we have test for carbonate. Principle: we have a chemical reaction here. 2HCl plus calcium carbonate CaCO3 that will result in the formation of CaCO2 plus H2O plus CO2. As we add 0.5 ml diluted hydrochloric acid to a small portion of the sample 2, gas bubbles will indicate the presence of carbonate. Next we have test for oxalate. Principle: in sulfuric acid solution, oxalate combines with oxygen to form oxalic acid. Method: heat a part of the sample 3 with 2 ml dilute sulfuric acid for 1 minute. Add 2 drops one by one of potassium permanganate solution and mix. The decolorization and evolution of gas will confirm the presence of oxalate. Next we have test for phosphate. Principle: phosphate ion react with ammonium molybdate to produce a characteristic yellow precipitate, ammonium phosphomolybdate. Method: dissolve a little of the sample 4 in about 1.5 ml of concentrated nitric acid HNO3, add a equal volume, that is 1.5 ml of ammonium monobitate solution, and heat to boil. If the phosphate are present, a yellow precipitate of ammonium phosphomolybdate is obtained. Next we have test for calcium. Principle: calcium is precipitated as calcium oxalate using ammonium oxalate. Method: dissolve small amount of sample 5 by heating with 2 ml dilute hydrochloric acid. Add 1 ml of ammonium oxalate. If white precipitate of calcium oxalate show the presence of calcium.